Okay guys, aloha, and well, it's the afternoon. We're going to do a video today on, well, what's on my neck. It's a snake, but we're going to talk about spirochetes. This video is called Degenerative Parasitic Spirochetes of the Mouth and Body. So think of this snake. You know what a snake is in this world, but let's just shrink this little guy down to the tiniest little thing that you could only see on a microscope. And let's talk about these things called spirochetes or spirochetes. So just sort of think that this snake right here, okay, is a spirochete. And we're going to shrink this thing down, and it lives inside the mouth. It lives inside the brain. It lives inside anywhere it wants to, in the blood. It's carnivorous. Okay, just like a lot of snakes, right? What do they eat? Vegetables? Well, they eat rodents, right? They eat other snakes. They eat birds. They're carnivorous. So these spirochetes, or spirochetes, okay, are the same thing. They live in the body, and they cause a lot of unknown and or known disease. So we're going to go over a lot about spirochetes, because a lot of people have no idea, even doctors. Okay, now, and I'm talking about, there's a lot of research out there about spirochetes. We're going to go over that in part 2. But in part 1 here, we're going to go ahead and actually give you what a spirochete is. Okay, and we're going to go over a few things too to make sense out of all of this. Because if these little creatures that are in your mouth, and they're in most people's mouths, I can attest to that. I have a good microscope. I have many researcher friends that have microscopes, and a lot of dentists that we're going to go ahead and show you. These things are in a lot of people's mouths, especially, remember, they always say that the window of your health is in your mouth. So every doctor should have a microscope in his office. Every doctor should go ahead and do we're going to go over gingival sample to be able to look and see what lives in that gingival sample. And maybe let's do a drop of blood too and see what's swimming around in the interstitial fields alive. So the snake, we'll just put him on my shoulder here. But just think, this little snake, thousands of them can live in your mouth, and they eat your gums. Thousands of these little things are in your mouth, and when you swallow them down into your gut, into your body. How do they get into your body? Well, they're in rivers, they're in streams, they're in lakes, they're in animals, they're in people. So we'll go over a few things on this video, and it's good to be able to see part 2, because we're going to go over some definitive research about Alzheimer's, cognitive impairment. Remember, parasites cause a lot of disease. And you already know that Lyme disease is caused by some type of parasite, right? Like syphilis is also caused by some type of parasite. Could it be possible that they are, of course, spirochetes? We're going to see. So spirochetes are just about in everything, and or can be in anything. There's many species of them, and some are pretty deadly, and other ones maybe are symbiotic and or live with the environment. Remember, they're in rivers and streams. How did I get them? Well, do you have a pet? Do you kiss anyone? Do you drink out of someone's cup? Remember, all it takes is one of these things, and, well, replication is pretty simple. So let's go over. I'm going to keep this thing on my neck here just to remind me here. Okay, we're going to take this snake and we're going to shrink it down to micro size. So let's look on video here. This video is called Degenerative Parasitic Spirochetes of the Mouth and Body. And this is a companion video that goes along with this video, Medicinal and Healing Homemade Toothpaste and Mouthwash, the ultimate do-it-yourself guide. Are you using regular toothpaste? Are you using regular mouthwash? These are just questions. because a lot of the things that we use in our personal care products, they're not good for us. And I go through in that description. That description is, let's see, this one is 54 pages long. They take a while for me to write. So, and we go into a lot of deep ideas, so you can go ahead and actually learn from these video courses. A lot of the deeper information on protocols, practices, and principles, those are always on Earther Academy on the private channel. We have hundreds of different video courses, workshops, I mean, just a lot of philosophy, because, well, there's lots of pieces to this pie. Okay, it's not just one department. It's not just toxicity. And if you have toxicity, what do you have to learn? Detoxification. It's not just water, because, well, water's everything, but what kind of water would you drink, or should you drink, or can you drink? It's not just diet, but it's understanding diet. Okay, like the difference between a plant-based diet, which I did and have on Earther Academy, 15 years of that, to an animal-based diet. Why would I change my ways? Okay. Everything that we do is an experiment, but sometimes it's better to go ahead and learn why we're going to do something, and or some background before we even experiment with anything. So Earther Academy is an experimental school, and we all learn from each other, and all I'm doing in my world is showing you at Earther Academy what I do and or what I have done. And my ways have changed, of course, over time. But then again, the same premise is always to be able to upgrade, enhance, and optimize your health and well-being. And that can change. And everybody's a little bit different, so we have to figure it out. So your toxic mouthwash that you're using, remember, that's not helping you just because you get a little fresh, minty breath. And we go over a lot of the different ideas, concepts, disciplines, and ways for you to be able to go ahead and exchange your toxic toothpaste mouthwash. And to be able to go ahead and maybe, let's see if we can regrow your gums back. I did. Okay. Let's see if we can make sure that you don't get any more dental caries and or stop what you had going. Because taking care of the mouth is very, very important. We talk about biodentistry and so forth because it's all pieces of the pie. But anyway, so let's get started. So let's go back to the spirochete. But, I'm going to show you, just to go back to the medicinal, because remember, I'm going to show you that there's a lot of different critters that live in the mouth. Bad breath. Okay, remember, a lot of things are coming up from your gut into your mouth. So what usually is in your mouth is also in your body. So doing microscopic evaluation of the gingival sample of the saliva is very important to be able to get a snapshot picture of your health. And if you've got these different creatures inside your mouth that you know that shouldn't be there, well, you really don't know. But the last thing you want to do is have one of these snakes, thousands of these snakes, out of one tiny little sample in your mouth on that microscope. And you're going to say, whoa, I got all those little snakes running around in my mouth? Yeah. You just didn't know it, right? Sometimes ignorance is bliss. But then again, once you find out, what are you going to do about it? Because these things aren't natural in your mouth. And there might be having a few of them because they're everywhere. And if you have a garden at your house, what do? You have to weed the garden. If not, the weeds grow bigger than the garden does. It's just what it is. The weeds steal what the garden produces. The weeds then go ahead and harbor a lot of different types of other pathogenic things that will also eat your plants. It's the same with the mouth. We call it terrain modification. And terrain modifying the mouth is very, very important to make sure that spirochetes can't live in there. Forget about your gums. And we've got lots of videos on how to whiten your teeth naturally. Okay, a lot of different videos on ear cleaning. When's the last time you cleaned your ears? When's the last time you cleaned your sinuses? Really cleaned your upper frontal sinus, your called the maxillary sinus, okay? And you've got ethmoid sinus. You've got all these different sinuses, 3 major sinuses in the nose or in the face. And these need to be cleaned. Upper, middle, and lower. Why? It's because, do you want to smell better? Do you want to be able to have your system be able to not have maybe mold inside the cavity because you live in the tropics, or maybe you live in the dusty desert and you're breathing in particulates all the time? You're sweeping your garage out. Remember, all these pieces are to be able to, just like you take a shower every day. So, okay, let's get into this. But anyways, take a look at Earther Academy. Have you cleaned your skin with the vodka solution? All these pieces. So I'm going to show you on the mouthwash video how to use 3 ingredients, the best ingredients for you to be able to use on everything, okay? Because this wipes out, sanitizes, reterrain modifies your mouth, and kicks out the pathogens that don't need to be there. And plus you get your dose of iodine for the day. Yeah. So anyways, take a look at that. Let's go back to spirochetes. Okay. So I'm just going to go ahead and read through a little bit of this just so you can go ahead and get a better idea. So you can listen to this, but it's good to see some pictures. And we may go ahead, because I'm just going to do this freestyle, but I wanted to do this video in accordance to why would you make your own toothpaste? Why would you make your own mouthwash? Not only because it's healthier, but it's because you want to get rid of a lot of garbage, okay, that lives in your mouth. You wake up every morning with tartar on your teeth, okay? Why do you get that? And you get a lot. It's like this cheese that comes out of it. If you scrape it off your tooth, right, and you see it on your finger, smell that stuff. Put it in your fingertips. That stuff's like a greasy, grimy, what is that stuff? Smells like some fungus, a mungus, like some cheese or something, right? Okay, so these are not just like topical mouthwash. These are mouthwashes for you to be able to keep your terrain so it's weed free, okay, or less weeds, we'll say. So in this Earther Academy video called Degenerative Parasitic Spirochetes of the Mouth and Body, I'm going to talk about a very common and destructive parasite found in the human mouth and body. These tiny, nasty, carnivorous parasitic creatures. Carnivorous means they are meat eaters. Creatures are called spirochetes or spirochetes. And this is what they look like. So think of this little guy right here, okay, is in your mouth and or it's in your blood, and it's spiraling. These are called corkscrew spirochetes, and it's spiraling like this, like crazy, and it drills a hole like a drill into whatever it wants to. And of course, it feeds, has babies, colonizes, and they keep on growing and growing and growing depending on how much food there is available for them to eat. I can tell you this, if your body's healthy, a lot of these things can't get to you because your body has healthy coatings inside itself. It has mucus coatings. It has protective coatings. But when it does get an injury, a bruise or broken tissue or whatever it is, remember these spirochetes then go in just like when an animal goes poop, all of a sudden there's 30 flies there in a minute because they're the ones that clean up. The spirochetes are usually just eating tissue that's just like a shark would eat a fish that's injured. It catches what it can, but it picks on the things that it knows it can eat very easily. The human body's not easy. If not, most people be sick. Your immune system, your body's protected by different sheaths. And when that sheath gets bruised, look how many people get hip replacements, knee replacements, and you don't even run, you don't even exercise. What is that all about? So you can see I'm going to stretch this out, but all these little squiggly lines in here, these are spirochetes. Spirochetes can be recognized by their spiral motion because they don't just swim. Some do swim in a circular, look just like a snake crawling on the ground. And they've got other ones that'll go ahead and are more erratic. And they say these things are pleomorphic. They do change depending on the acidic environment. The more food there is for them, the better the environment is for them, the more they can colonize inside your system. And as, like I said, we'll get into part 2, we're going to get into a lot of diseases that are associated with these spirochetes, including dementia, Parkinson's, different type of neurospinal. Remember, these parasites can go anywhere, and these are just one of many, many. Okay, these super tiny creatures, parasites, are called spirochetes, as seen looking through the microscope at a 400 times or so magnification. You can see them at 40 times magnification, but they're better to see it like 200 or 400 for sure. And the better microscope you have, the better, of course, but you can see these on very cheap microscopes also. There are many forms of spirochetes, and many researchers will point out that they are mostly anaerobic, which means they live without oxygen. Anaerobic spiraling bacterial forms, parasitic in nature, can be destructive and disease-causing creatures. As you'll see, like I said in part 2, we'll go over a lot of the different information. I'm going to give you lots of links for you to do your own research. I'm not asking you to take anything in your own hands, but I do. I try to keep myself healthy, wealthy, happy, and wise because I make myself so. If I don't do anything about it and I just eat anything and anything, and I don't do anything to be able to deaccumulate the accumulated heavy metals, plastics, or whatever it is in my body's going to clog after a while, just like your car if it needs to get its oil changed. You're not helping your car by changing the oil every 15, 20,000 miles. It's good to change it every 2,500 to 35 to 4,500 miles maximum. Why? Because that's the blood of your engine, and that's the engine life, is the blood. Same with your blood. So there are many forms, like I said, of spirochetes. Further in the description, I will show you in more depth what these parasitic creatures look like and the nasty diseases they can cause. Destructive parasitic spirochetes have been found to grow anywhere in the body and can easily colonize, if the terrain is right, into the millions of little parasitic savages, all wanting to feed on flesh, food, or something they can thrive on, and of course complete their life cycle and continue to replicate themselves. These are called like the replicators. Okay, a lot of parasites are. A lot of parasites, pig tapeworm, beef tapeworm, fish tapeworm, these can kick out millions and millions of eggs in their lifetime, and they can live for many years. These types of parasitic forms can create havoc, assault to the body, and have the ability to travel through and swim in the intestinal fluid of the blood. I just wrote this, it's taken me months to go ahead and put all these pieces together, but I haven't given its final draft here, so I'm reading a draft right here. So, can swim in the intestinal fluid, and they can swim also in the blood and can attack, eat, and destroy living blood cells, inflamed tissues, such as in the mouth, inflamed tissues. Remember that. They're not really picking on the good tissue, is because it's protected. They're picking on the inflamed tissue. So let's say you're smoking cigarettes all the time and taking in really hot smoke or whatever you're smoking. You're brushing your teeth way too hard with a toothpaste that's got way too much abrasion in it. It doesn't have enough oil, okay, or softness to the oil. You're brushing with too hard a brush, whatever the case may be. You're irritating your gums. Now your gums now are open to, if you have spirochetes in your system, they just found a new food sources because that new tissue that you're scraping away, and I'm not just talking about taking off the surface, you scraped it down, right? You irritated, you got a tooth infection, whatever it is, you have spirochetes for sure that can come in and feed off of that diseased or damaged tissue or inflamed tissue. Inflamed tissues of the mouth, such as the mouth, gum, area, causing receding gum lines and tooth decay. So think of it as if your gums are receding, then if they're receding, then it's either you're wearing them out or they've been irritated because you have an infection in your mouth and they're just going to town on your tissues that are unprotected. And you can see on teeth that or gums that are irritated, and I show you lots of pictures in the descriptions in the toothpaste video on healthy gums versus gums that are irritated or diseased. So spirochetes have been found to go hand in hand with intestinal ulcers, along with many other intestinal syndromes such as leaky gut, and IBS, along with many other diseases such as dementia and Alzheimer's disease. So let's say now you have leaky gut syndrome, right? You have irritation of the intestinal wall. Maybe you're eating too much glyphosate, too many herbicides, pesticides, insecticides, whatever it is. Maybe you're eating too many oxalates. Maybe you're eating a lot of wheat, corn, soy, seed oils, and you've inflamed your gut by a variety of different assaults, whatever the case may be. Maybe because you're dehydrated, whatever. It's a lot of different pieces, remember, to this pie. And if you've got irritation and you've got spirochetes, like it says in the gut here, what do you think they're going to feed off? The new tissue, the damaged tissue. It'll never heal. Okay, so this is just to get in your minds a little bit. If you have intestinal and or any type of inflammation in the body or any type of damage, if you have these spirochetes inside your system, then anything that can feed upon the damaged tissue is going to go to that spot. They're all going to synchronize maybe into the hip, and they're going to eat all that joint apart, right? Once it gets damaged and inflamed, they start getting in there because it's been damaged. It's like the hull of a boat. If you breach it, the water comes in. Okay, so if the hull of the boat is sealed perfectly, then the water can never get in. But for some reason, just like some type of whatever inflammation that you've got in your intestinal tract, and you get a breach in that hull, you get tissues that are inflamed, then these types of creatures can come over there and feed. Remember, these creatures can feed. And if they feed, they also poop inside the body, causes more dysfunction. Everything poops. And not only that, well, if the environment is perfect and there's lots of food, well, then everything will quantify themselves. They'll get stronger, faster, quicker, and they'll colonize more. Companion video of this course, disease-causing parasitic spirochetes of the mouth and body, is a companion video to what we already said, medicinal and healing toothpaste and mouthwash. In the video course, I will show you how to create several natural recipes. Okay, It's very important if you're going to go to the dentist, go to a biodentist. I would not recommend going just to your regular dentist. And if that's all you got, that's all you got, right? But there's many things that you could do to be able to stop tooth infections. There's many things that you can do to be able to stop a cavity, an enamel-eating bacteria, or some type of maybe protocols that you're doing incorrect, like eating lemons or oranges, and you've got dried fruit in between your teeth, and you go to bed at night, even though you brush your teeth, it's still stuck between because you're not using your water pick, which is very essential. We'll get into that later too. Water pick is one of the best essential tools that you could use to be able to wash out spirochetes. Remember, you're not supposed to use the water pick unless you're using the brush water pick. I wouldn't recommend using any other attachment, is because you could actually damage your gums by using the water pick with too much pressure and force. And there's one that looks like a toothbrush on there, and that's the one I use. And of course, if your gums bleed, it means most likely you've got some problems in your mouth. Most likely you have spirochetes too. The biodentist that I use is Dr. Lori Cardellino, is a longtime friend and expert biodentist in Ventura. I've been seeing exclusively for 13 years. She's located in Ventura, California. She specializes in repairing incorrect dentistry that other dentists have done or caused, and she's also, her specialty is oral surgery. In order to usually fix the cause of the body, you need to fix the mouth that sometimes caused it. A lot of people have mercury fillings. They've got nickel, molybdenum, all different heavy metals in their mouth. Anyways, mouths are a mess. I have lots of videos on what I did. And I had to restore my mercury fillings, and then I put quartz crystals in there, and those didn't work the greatest. And so I had Dr. Cardellino take all those out and really clean up some of the areas that were missed, and replace it with compatible. This is what a biodentist does, using compatible materials instead of using toxic materials. And all the materials are toxic. It's just others are way less than others. Especially the last thing I want to do is have an antenna in my mouth with a bunch of metal being around microwave transmitters all the time. She always tells me how I have such healthy gums and teeth for my age without any bleeding or inflammation, running of the gums, recession of gum lines. I would say because adhering to specific protocols I use for my gums and teeth, and of course, seeing the correct dentist to fix my, well, dentistry that I had previously that was a disaster. A lot of dentists cause a lot of problems, let me tell you. Okay? And if you take care of your mouth, you don't get any type. I haven't had any dental problems in so long. Once I found out how to be able to not only have a better diet, okay, and a better diet meaning that I'm making sure that my body is not being malnourished by being. I remember I was plant-based for 15 years, and you'll notice lots of people plant-based vegans, their teeth fall out. You got a lot of dental caries. You got a lot of receding gum lines. Your blood, your hands are white. You don't even have any color in your blood. Okay, I see that in a lot of people. I always put my hands out like this, and you can see how purple my. Let's see, get the video. How purple those are when I stretch them out. Okay, and a lot of people, their hands won't have any purple to them. Okay, so when I stretch it out like this is the color of a lot of people's hands, but you can see it when they're normal. They're super high, rich in color, in this sort of purple color. Even though I got this crummy LED light with I've got a filter on it too to take away. Anyways, it's good to find yourself a good biodentist. Okay, root canals, remember, they're not allowed in biodentist's office. There's no reason to do root canals, and if you have to pull the tooth. Okay, and I'm just putting here, at this time, my excellent tooth and gum health, which was never that way before, is completely attributed to my own personal, all-natural dental care protocols and seeing a qualified biodentist when needed. I have followed these protocols for years and have completely resolved my prior receding gums and degenerative tooth decay. Okay, so anyways, let's jump into... well, and we'll get into this right now. In this two-part eye-opening video course, I will go over the correct natural compounds I have found over the years that support the eradication of many of these types of pathogenic bacteria, parasites, spirochetes, pathogenic creatures. I'm also using other natural compounds in the recipe to support the nutrition, feeding the gums and enamel of the teeth to strengthen and or support the repairing of them. In part... wait a minute. That's still on the toothpaste, but anyways, okay, let's get into this. I got a lot, like I said, I got a lot going on. You can see how many tabs I got going on up here. I'm constantly researching. I've got about 10 different departments I'm always looking into. And this one here, the spirochete, like I said, is very important to learn about. Spirochete definition from a biological dictionary. A spirochete is a type of bacteria with the phylum Spirochetes. The spirochetes are also called... The spirochetes are also called this because they are very long, thinly shaped, and helical coiled. Hence, they are spiraling corkscrew shape. The helical shape is one of the three morphological categories of the prokaryotes. Okay, prokaryotes, a type of parasite. Anyways, you don't need to know that. The spirochetes are a diverse phylum occupying a wide range of ecological niches. Some are free living in aquatic environments, while some can survive by parasitizing the cells of other organisms. Very important to know. These parasites, remember, they go and drill themselves into the red blood cells of anything, animals, people, and then they eat the nucleotides inside, and then they make babies inside there. I have lots of videos I'm going to show you that have these spirochetes inside the red blood cell. You can see them just going crazy. How'd they get in? And they drilled their way in. Look at all the other ones trying to get in. Most of these creatures are anaerobic. That means they can sustain themselves without any presence of oxygen. Although certain species are aerobic, which means they can breathe air. They are difficult to culture and are gram-negative, meaning they are not easily visible. Well, that's true and not true. It's nice to have a dark field microscope because you can see them much better because it'll show them against the background. But you can see them on gingiva samples quite easily without dark field. The blood is a little harder to be able to see because the filters do make a big difference. And having a good microscope and having a good monitor makes all the difference in the world if you're going to look at the blood. Although some play an important role in the symbiontics within the stomach of other animals, many members of the spirochete class are responsible for common diseases such as Lyme disease and syphilis. Some spirochetes have been found present with marine bivalves, although bivalves, those types of marines, with no apparent positive or negative effects. This neutral relationship is called commensalism. Spirochetes are distinguishable from other bacteria in that the way they move through unique endoflagella. Anyways, keep on reading and go through this, okay, because it's very, well, I'm not going to go through everything, but I'm just giving you little pieces here. Okay, the flagella are tightly wound around the corkscrew shape of the bacteria between the outer membrane and the cell wall within their periplasm. Together, the endoflagella make up the structure called the axofilament. Anyways, these things spin like crazy with these little fins on the side of them. Remember, this is just some stupid little snake that's not that stupid. And it does have a program, and that's why I call these things demonic, is because these things are eating us to death. And not only these, but many other creatures. Okay. Spirochetes also secrete ammonia, as many other parasites do in the body. This ammonia is poisoning of the body's biological liquid matrix of life and can cause inflammatory reactions along with negative cognitive and neurological symptoms such as ADHD and others. Okay, you know what that is. Attention deficit hyperactivity disorder is a neurodevelopmental condition that causes differences in the brain related to attention behavior and activity levels, including impulsivity and hyperactivity. I know a lot of people, a lot of children, a lot of people have that. Okay, could it be possible? Spirochetes, remember, parasites, they all secrete ammonia, especially when you kill them. If you go into the sauna, you'll notice, I don't have it happen to me that hardly at all anymore, but when I used to go into the sauna for years, I would, before I'd go out, I'd take a small towel and I'm going to wipe off all the sweat off my body and really scrub it really hard. Remember, watch the videos on the sauna protocols. And then I'll close up the towel like this, let it sit for like 20, 30 seconds, and then open it up and smell the inside. It's a massive amount of ammonia. I got rid of all that ammonia out of my body. And the heat, remember, causes a lot of problems with parasites, especially because, you know, the more body fat you have, the less the heat can get inside you. But the thinner you are, the more cleansing the sauna is. So, anyways, spirochetes secrete ammonia, as all different parasites do. So, okay, so let's think of this. Think of the kissing concept, kissing disease, swapping parasites. Can you become infected by spirochetes and other parasites of the mouth from kissing or swapping any type of bodily fluids? Yes, you can. The spirochete is able to pass through the intact mucous membranes or compromised skin. Remember, they have to get in something that's compromised. It is thus transmissible by kissing near a lesion, as well as manual, oral, vaginal, and anal sex. Wikipedia. Lots of references to go along with what I'm telling you here. Click on Wikipedia. You'll go ahead. It'll take you there. You'll see all the references. The references are right there. These nasty parasitic creatures are very common in most people when testing gingival samples. Gingival samples is a little sample in between the gum line and the tooth, 1 to 2 millimeters in. Usually behind the where you want to find the creatures are in the back molars. This is where a lot of food stays inside there, and or you have irritation because you didn't get the food out and it's rotting inside there. These creatures can be seen with a simple microscope. For most people, these creatures can be seen, again, like I said, I'm going to say a few things over and over again, but you'll get it. Gingival samples on microscopic examination at 40x to 1000x magnification. All cheap microscopes will do that, pretty much, at least up to 400. If you've never had your mouth gingival salival test with a microscope, let me show you what you may not want to see. Most people have no idea that their mouth holds up to 700 plus living microscopic creatures that are easily transferable to one another, including animals. The mouth can literally hold thousands of types of miniature snake-like parasites, and the only way you will really see the truth that you are infected is to check through microscopy. Does your doctor have this? When you go to the doctor, also check out their physical shape. Does that doctor, do they stay in shape? Do they look like they're healthy? All these pieces. Do they have a microscope that they're going to show you? Because we want to see, remember, the mouth is a gateway to maybe what the rest of you looks like. It's like your swimming pool, and it's just like a little porthole over here that you can get an idea of what, remember, what lives in your mouth, you swallow. It lives everywhere. It's not just in the mouth. If you have receding gums, bad, stinky breath, red, irritated gums, tooth gum infections, or any type of dental caries, then most likely you have these types of parasites eating away at your tissues. Every one of these little squiggly guys, I'm not going to show you any video on here because I don't need to have problems with social media. Yeah, you're scaring me. We'll show you that on part 2. I got a lot of videos for you to be able to see under the microscope. Samplings will be taken so you can go ahead and see, and other people have taken too, so you can see these creatures are real. This is a gingival saliva sample. You can see it's on 1:12 on one of the videos I'm going to show you. This is a gingival sample taken from a friend. You can see hundreds, if not thousands, of spirochetes in a small drop-like sampling of saliva between the tooth and gum line. Each one of these little, where my little cursor is, that little guy's a spirochete. That little guy's a spirochete. That little guy's a spirochete. Okay, it looks like a sky that's got a ton of aerosols going across, right? And same type of thing. That's in your mouth. So here you go. You ever let the dog do that to you? And maybe you don't, but your girlfriend does, or whoever else that you're kissing does. Remember, everybody's got a lot of weird stuff growing inside, not only on their skin. This is why the skin cleaning protocols are essential to do at least once a week, at least. And look at how dirty your towel gets. Jesus. Cleaning the pores. I see people all the time letting a dog, cat lick their face and swap saliva fluids back and forth. The question is, who is infecting who? Is it the dog infecting this girl, or is it the girl infecting the bloody dog? I would say, and this is, I'd say it's even more, but I'd say 7 out of 10 people I've tested over the years have mild, moderate to severe infections, infiltrations of these snake-like creatures or spirochetes living in the mouth. Amoebas, all weird stuff that's in there. They're not supposed to be there. 1 or 2, big deal. But if you got a lot, you got an infection. And that infection, maybe you don't even have, maybe your teeth and everything look great in your mouth, but those spirochetes are because that's what's in your body, and they're just in your mouth too. But they're beating on other stuff, but they're all over the place, let's say. I have also noticed when testing gingival and blood samples that people with any type of underlying diseases like diabetes, fibromyalgia, memory loss, cognitive impairment, depression, obesity, etc., most of the people I tested had spirochetes not only in the mouth, but also in the blood on microscopy. This is well known. Anybody that does live tissue or live blood examination can show you this. There are lots of biodentists. A lot of them don't show this, that some do. And if they do, you're going to want to figure out how to get rid of them. And there's a variety of ways to do this. You can see this is a plaque sample. Again, this is another gingival sample that has, let me get rid of me in the corner here, that has thousands of rod-shaped spirochetes in the mouth. Thousands. Okay? Remember, these creatures can be easily swapped with one another using the old age proven technique called French kissing or exchanging bodily fluids for another layer of deeper thought. You wonder why just about everyone has these little snakes crawling inside them. Maybe you don't. I've seen some people that don't. But that's like a prerequisite, right, for your next mate is let's check and see. I'm going to show you mine, right? And let's see yours. And if you do have that, before we kiss and do all that other stuff, honey bun, we're going to have to do a few protocols to be able to at least sanitize your mouth. Maybe they're still in your body. We're going to sanitize your mouth before we do any French kissing. Okay. When I was a child, French kissing, or what some people called kissing disease, we were told in school that we would get sick by kissing this way. As a child, I thought this used to scare the crap out of me, scare me to death when that we were going to lose our teeth and get gum disease or infection, because that's what they told us. And that's true. There's a lot of people that have gum disease. And remember, you get gum disease, you lose your teeth. And if you've got these critters inside your mouth, the tissue can never regrow. It's just constantly getting beat up. And maybe you're brushing hard, or you're using even too harsh of a food grade hydrogen peroxide, you're still irritating your gums. You're burning them. There are many natural, simple, and effective ways to reduce or eliminate these types of parasites and other pathogenic anaerobic bacteria using the correct compounds and protocols. Consistent is the whole thing. I work out consistency 3 times a week. Okay? This is what keeps me healthy, wealthy, happy, and wise. Okay? And if I don't take care of myself, I get fat and chubby like everybody. Here, I'll show you one more time. Look. That's pretty good abs for an old man, 64 years old, still. Why? Not because it's just there because it's there. It's because I make sure that my body stays at least as low in toxicity as I can. And body fat is toxicity. Yeast, mold, fungus, candida, remember, and it does eat sugar and or processed carbs. Okay, learning about spirochetes is usually new information for most people, doctors, or anybody, because they don't teach this stuff. They just don't. They'll go ahead and say you need, anyways, I'm not going to get into that. It is essential to add this information to our personal field of knowledge and to look at these tiny spinning parasitic spirochetes in the mouth and blood and study them further. Spirochetes remind me of the little tiny snakes, serpents, swimming frantically, searching for food in the body and in time replicate once again, thus increasing their kingdoms. These creatures, as you will see, are moving by spinning themselves frantically, so I call them spinners. When they spin rapidly, they are akin to like a drill bit, making a hole in a piece of wood and can cause destruction in many areas of the flesh of the body. Before I get into showing you how to make the medicinal toothpaste and medicinal mouthwash recipes, I want to talk to you about carnivorous parasites, because I took this little piece out of the other one there. One of the reasons we're going to look at parasites of the mouth, especially spirochetes, they are easy to see and verify on microscopic examination and gingival sample, and easy to see on blood microscope examination too. Okay, so let me shrink this thing down a little bit. There we go. It'd be a good idea for you to either buy your own microscope just to be able to investigate and research. Investigate your friends. Check out the, show, there's many different YouTube channels and everything else that can show you how to do this. It's very simple. I'll show you how to do it. Okay. Have you had your gingival saliva microscopy examination lately or anytime? Does your dentist have a microscope? Okay. So here's exactly how, this is where you're pulling out the tissue, okay, that you want to examine. And so a lot of times I'll tell people, if I'm going to do your teeth in the morning, don't brush your teeth at night one night. Or if you do, just do it very lightly, but don't dig in there, don't water pick and stuff. And then in the morning, let's take a little instrument. You can even use a piece of floss, get out a piece of anything, okay? Get a little piece in between the first, as you can see, I'm going to put it on my cursor here. This is the end of this is the gum line. And when people recede their gum lines down, they go down to right here, the bone. And once you do that, this whole thing, remember, these spirochetes eat everything inside and outside, and this root falls off. It's just done. You take a sample in between the gum line and the tooth, and you put that on the microscope. Okay, so you can read, this is called a periodontal probe. The periodontal probe is used to routinely examine the space between below the gum line alongside your tooth. The space is similar to the space between your fingernail and your finger. When your gum tissue becomes inflamed or diseased, dentists refer to the space as a pocket. Periodontal probes have calibrations in millimeters to measure the changes that occur during the progression of periodontal disease. The higher number of millimeters below the gum, the more loss of attachment to the tooth has occurred. Okay, so that's just telling you, the further you put in that probe, you can see the little lines on there. It should only really come up to just to this edge. The further you go in, the more disease you have. This is where you want to pull the spirochetes out of. This is where they are. It's not just in the saliva. I've seen people, they put a little spit on the microscope slide. Like, there's nothing in there but a couple of maybe whatever, some simple flagellus, whatever's in there. The area of the tooth where you get the correct sample is between the gum and the tooth line, as seen in the picture above. The material gathered from between the tooth and the gum line, usually probing 1 to 2 millimeters deep. This is the area where the spirochetes live, and it is most of the time easily found on an infected gum or tooth. And you can see, look at how nasty this bloody tooth is right here. Look at this thing. Okay? And this bad filling, the tooth's falling apart, whatever it is, pulls that flap open. Look at how red that is. Look at how red all this tissue is right here. This guy's mouth's full of spirochetes. You can see, look at the receding gum lines. Look at his teeth. The tissues, they're white. This is not healthy gum tissue. Okay, so behind the gingiva of an infected tooth is where the mold pathogenic bacteria spirochetes colonize, replicate, and feast on the infected, rotting flesh. Bad breath is usually a first sign of some infection going on in your mouth. Odorous smells come from the mouth is a sure sign that you have a full mouth infections, parasites, pathogenic, anaerobic bacteria. Okay, so again, read this description. This is from a blood sample. Okay? And you can see these little spirochetes in here. Let me blow this up. This red blood cell, you can see, is very small. Can't see them with your eyes. You have to put it on 400 times magnification to make it look real big like this. You can see, check it out. Look at how long this spirochete is. And these things spin. Some of them do swim like a snake. And those are supposedly the ones that are less dangerous than the ones that are corkscrewers going crazy, corkscrewing into things. Okay? But they get inside and corkscrew in the RBC, replicate, and they eat the internal ingredients of the RBCs. Even though there are many types of spirochetes known, most scientists, doctors, and researchers have no idea about these destructive parasitic creatures and the destructive role they play in sick, diseased individuals. A small percentage of clinical researchers, doctors, mostly dentists, have been studying these types of parasites intensely over the years, from patient samples of gingival samples and or looking at blood samples to study them from their patients and treatments protocols to reduce and eradicate these parasites and pathogenic forms of life. So this is using a 10 times magnification, like let's say 400 times. You can see the red blood cells in the parasitic spirochetes or carnivorous snakes in the blood matrix. Later on in the description, I will explain more about spirochetes and the other disease-causing microparasites. Most doctors, researchers, and people in general have no idea about parasites and are now just starting to be noticed by more doctors, biodentists, science, and common people alike that are wanting to see for themselves that these creatures can be the cause of a lot of hidden disease. So let's take a look at these bizarre creatures called spirochetes, or tiny snakes that have the ability to live anywhere in the body. Remember, most likely, if you have receded gums, bleeding gums after you brush, bad breath, or any signs of any tooth decay, you most likely have a mouthful of carnivorous spirochetes feasting on your delicate gum tissues. Anyways, I say down here, watch the short video to get an idea of what a colony of spirochetes look like in the mouth from a gingiva sample, attacking, killing, and feeding upon the white blood cells and other tissues. So you can see them right here. These are, these are cells. Everything you see that looks like a little stick right here, these are all spirochetes. And you should see this thing, man, in action. Just the whole screen looks like that's an invasion. That's a bloody invasion. And again, like the weeds in your garden, you must tend to the weeds. If not, you don't have a garden, or your garden will be very weak. Degenerative spirochete parasites of the mouth and body. Let's look into the silent parasitic disease that many unsuspecting people are infected with right now in their mouths, eating away at their gums or inflamed flesh in the mouth. For many decades, it has been well known in biodentistry and holistic dentists that they may have their own microscope and do gingival checks on patients to see the various bacterial loads and to look for parasites called spirochetes. Anyways, again, this is just to get this into your head a little bit. Spirochetes are just one area of parasites that have caused much disease in both humans and animals. Okay, so, and you can cross a lot of disease through a variety of different things. Like I said, animals, sexually transmitted disease, just a lot of ways. Spirochetes are bacteria that have an importance in medical because of causing disease, but they have not been well understood. And this is from an article. It's a study on Science Direct, Oral Spirochetes, Pathogenic Mechanisms in Periodontal Disease. Spirochetes, especially the T. denticola, play a notable role in periodontal disease and are also prevalent in other oral infections. Periodontitis influences the risk of systemic disease such as arterial and atherosclerotic, rheumatoid arthritis, and some kinds of cancer. So this review has analyzed mechanisms of pathogenesis of oral spirochetes in periodontitis and oral infections. Therefore, it will help us significantly treat these diseases. The review of the included articles has been shown that oral spirochetes cause degeneration and disease. So I've got lots of different things for you to watch right here. Read the rest of the study. How spirochetes colonize and cause gum disease in your mouth. These are all videos. Holistic Dental, this is a YouTube channel, shows lots of videos on spirochetes of the mouth. Spirochetes attacking the white blood cells. Okay, so the oral we've talked about this before. It's the microbiome of the mouth. You can have the microbiome of your colon, the microbiome of your intestinal tract, the microbiome of your interstitial fluid of the blood. The oral microbiome is a very special place to investigate the health of an individual. Not only does the mouth have its own microbiome, the mouth also shares the microbiome of the gut and other parts of the body. Like I was saying, whatever's in your mouth is a good window to be able to see what's in the rest of the body. Remember, when we do a blood sample, you're just taking one drop. Your body's got, let's say, 5 liters of blood. Just taking one drop. And that one drop on an infected person has tons of spirochetes in it. How many do you have in your whole body? Remember, one little piece of gingival sample. Look how many of these guys are swimming in there. And remember, they're carnivorous. When we realize that we produce more than a quart of saliva a day and we must swallow most of it, the good and bad microbiome is easily swallowed and introduced into the intestinal tract. Many people have IBS and other digestive tract issues, including leaky gut syndrome, which can cause severe irritation and inflammation of the intestinal tract, causing tiny perforations or holes, letting out some of the intestinal parasites or microbes into the internal part of the body, causing other forms of disease in bones, organs, glands, and blood of the body. And then I've also attached an article by the National Institute of Medicine, Oral Microbiota in Human Systemic Diseases. Read the article. Study to see the research point to multiple diseases are connected directly to the pathogenic oral microbiome that is associated with the liver, that is associated with liver disease, rheumatoid arthritis, cardiovascular disease, IBS, or intestinal disease, dementia, Alzheimer's disease, pancreatic disease, and even types of cancer. This is what they're saying. I'm not saying this. And you can see sampling of the saliva. This is just a picture. You got all these things in here that live in here. This is the microbiome. Some are good and some are evil, just like the place we live on. Okay, so over 700 kinds of microorganisms are colonized in the human oral cavity. The oral microbiome is one of the most important and complex microbial communities in the human body and is one of 5 research priorities One of the 5 research priorities: oral cavity, nasal cavity, vaginal, intestine, and skin of the Human Microbiome Project. And that's a whole project on microbiome. Anyways, oral bacteria directly affect the disease status of dental caries and periodontal diseases. The dynamic of oral microbiota cooperates with the host to reflect the information and status of the immunity and metabolism, okay? Because what's in your mouth is in your body. Again, read this way deeper than I'm reading it. I'm just going over just to get you interested so you can go ahead and actually learn about all this stuff. Particularly, a large amount of evidence has proved that bacteria are closely related to tumor development in the past 2 decades. And there's all the different sites and the studies and so forth that are hooked to it. It's all in here. Increased evidence supports the association between oral microbiome and human systemic diseases. Adults produce more than 1,000 milliliters of saliva a day. Again, and you're swallowing most of it. Whatever lives in the mouth, you're swallowing into the body. Once it gets into the body and you have an IBS, it gets into the other parts of the body, because the mouth is just a tube. From the mouth to the anus is like a 35-foot tube. It's got protective sealants on it inside, so whatever lives in the intestinal tract can't get into the body. You got holes, breaches in the hull, then they can get into the body and cause other problems and go into places and make houses into places like your brain, okay, or any other place that's got inflammation. Let me get a swallow of my lemon water with a little bit of minerals. Could receding gums be caused by spirochetes and other pathogenic parasites? The short end of the story. Read it. Yes, it can. Dentists have been looking, studying, researching spirochetes and a host of other pathogenic creatures that live in the mouth for decades using a simple in-office microscope. I have only met personally, I've only met a small handful of biodentists, research practitioner dentists who will perform one of the best types of examination there is. Remember, look into the window of your health. Let's look in your mouth. And doing it correctly, too. Using the microscope, looking at gingival samples from the mouth and gums. This shows me what the rest of your terrain is. So, anyways, buy your own microscope. Again, you can buy them for $150, cheap ones. And if you want to get better ones than that, then you want to maybe go to Biomedics. And we'll get into this later on, the microscope that I have. And using the researchers that I work with. Not work... work money-wise, just research with. And this is my correlation. I've noticed, and everyone else has noticed this too. It's pretty simple. I've noticed a direct correlation linked to an unhealthy mouth equals unhealthy terrain full of parasites, pathogens that can be found in the mouth and the blood. Most of the people I've tested with their gingival samples with the microscope, almost every one I see has mild to moderate spirochetes, different amoebas. Anyways, amoebas look like a snail or slug crawling in the mouth, devouring whatever food it can. They don't really hurt you, but they're not supposed to be in there. So this is what they look like when you really magnify them. This is 2,500 times magnification parasitic spirochete. Check that dude out. Look, it's shaped like a corkscrew opener, like you're going to open up a bottle of wine. And you can see those things are drills, man. So this is a video. We're not going to show it again just because. Copyright, this, that. I'll show it on part 2. Part 2 will be on Earther Academy private. $10 a month. I got a lot of stuff over there. Just keeps the balls turning. Keeps the balls rolling, right? Keeps everything going. Nothing's cheap in this world to keep going. And I'm glad I don't have to live off any of this stuff at all. That's why I make it so cheap for people. Hey, join for a month, 2 or 3, or there's lots of things there to be able to learn. Like I said, not even cleaning your skin. That's basic, but you haven't done that before. Learning how to relubricate your skin correctly, but also being able to soak your hands and feet, okay, in different liquids to be able to see if you can detoxify them. So in this treatment here, instead of using a CO2 laser, I'm going to show you different ways that I showed in the toothpaste demonstration That other video, remember, these are companion videos. And the mouthwash that we're using, this gets rid of a lot of spirochetes, if not all of them, if you use it consistently. You don't have to spend a lot of money doing a CO2 laser treatment, but that does help, for sure, immediately. But then again, remember, these things live in your body and they're coming back. Okay, so the dentist is going to use a CO2 laser treatment to clean up the spirochete invasions. These types of in-office dental treatments are effective for removing the spirochetes, but are semi-painful, time-consuming, and expensive. Just because you killed the spirochetes in your mouth doesn't mean that they're not going to come back. Spirochetes not only live in the mouth, but can easily live anywhere in the body fluids too, causing reinfection quite easily once again in the mouth. I found out you don't need to have these expensive treatments. You can eradicate the parasites, these snakes, from the mouth quite easily yourself using the various protocols I showed you in the video course, medicinal and healing homemade toothpaste and mouthwash, the ultimate do-it-yourself guides. As you can see in the picture, this looks like a pretty healthy mouth. The gums are slightly receding, nice pink healthy color on the gums, no bleeding, dental caries, but her mouth was full on examination. Taking a gingival sample was full of thousands of spirochetes on microscopic examination. You don't have to have an ugly looking mouth, teeth, gums to have that, to have a mouth that is full of disease causing parasites, spirochetes, as seen in the video clips. Having acidic terrain in the mouth and body is a breeding ground for parasites, infections, inflammation, degeneration, disease to advance. These spirochetes and other creatures in the mouth are definitely causing increased damage, degeneration to any inflamed tissue or newly formed tissues that are eaten, devoured for food, and or causing acidic terrain environments to promote self-replication for themselves, causing thousands to form in an eating frenzy. Okay, so just because you have not had a microscopic examination of your gingiva doesn't mean you do not have plenty of them swimming in your mouth. I would say if you have bleeding gums, bad breath, red or inflamed gums of any type, any loss of receding gums or tissue, you most likely are loaded up with these snake-like carnivore creatures eating you slowly alive, a little bit at a time. So what I did was I took out, I put together, I haven't done the video yet, but this video, and it's like 200 pages of information, understanding parasites, anti-parasitic medications, and effective treatment protocols. That be coming out shortly. Take a watch for that. This is a short section of I took out of the 200 pages there, because I go into a lot about parasites, a lot of different species, and what they cause to the body, and different types of anti-parasitic medications that are very effective for them. Because there's a lot of anti-parasitic meds that are very dangerous to take too. And they should be only taken if you can with some type of medical professional, and or you need to read up a lot about before you self-medicate or do any of that, which I'm not recommending, just because. You're just not supposed to, right? I do myself because I have a lot of background. But anyways, this short section called Carnivorous Spirochetes has been copied from my future video course and workshop description in book form. The Earth Academy book workshop is called Understanding Parasites, Anti-Parasitic Meds, and Effective Treatment Protocols. Anyway, shortly it says I'll be filming this. I will also go into deeper teachings for you to have a better understanding of the bizarre world of parasites and their in the private part of the course. I will show you the protocols I have used and the positive and negative results of them. Keep an eye out for the release of this information-packed Earth Academy video course. So, as we already know, these spirochetes can be found anywhere. They can be found in insects, and eat the bugs, eats the bugs. Really? Remember the eggs. It's not the spirochete that's dead, these eggs. Eggs, remember, eggs are, if the terrain is correct and haven't been damaged, and the eggs are very protective. Protective meaning they don't die easy. Okay? They stay intact for a long time, years even, dried up until they find the right terrain to be able to come alive, like the zombies coming from the death, right? That's why I call them demons. So The spirochetes are found, remember, they're found in humans, oceans, everything. All over. Let's see here. So let me just finish this little piece here, and then I'm going to go on to part 2. Part 2 is private, and I'm going to show you a lot of videos and stuff. I got a lot of videos stacked up here to show you. The spirochete invasions on Microscope. So I just wanted to, in this video, is just to be able to bring to your awareness that snakes that crawl on the ground here, and you knew I got bit by the viper, remember? I was in the hospital for 6 days. I took 66 vials of anti-venom, and my medical bills were over $600,000. And I walked myself out of the hospital. I wrote myself out to write myself out because they wouldn't let me leave, because they wanted me to stay for 2 more weeks. Anyways, on the 6th day of Genesis, on the 7th day, I was resurrected. Okay, it did change me in many ways. But the snake that bit me, remember, that's a potent, powerful poison, twin venom viper. But I really learned a lot, okay, since then. That was about probably 10 years ago. More, 15 years ago, I got bit. I was, like I said, I was in intensive care for 6 days, almost died. The ones in your body, okay, are dangerous also. It's because they can kill you. Remember, the snake I got bit with, which is the twin venom viper, will kill you if you don't get any treatment. It's the most powerful viper in North America. It's just what it is. Okay, so you have to understand that the parable is the snakes that crawl on the ground here, the venomous snakes, these little ones here, remember, these are in thousands of colonies. What they make up for their size, they make up in the amount that they bring with them. One snake bites you. Remember, there's a snake here and there outside in the real world, but in your world, you can have literally who knows how many. Remember, you could have 1,000 on a sample. And that's just a sample. It's not your whole body. Who knows? This needs to be definitely investigated further from all different types of doctors. Anybody, just normal people looking into this, is because if this could be a lot of disease that a lot of people just don't see. Anyways, there's a lot of information on spirochetes for you to start your research on. These tiny carnivorous creatures can be easily found in most humans' mouths and blood in significant numbers on the infected, unsuspecting host or people. Almost everyone I've tested, except for a minor few, have tested positive for being infected with spirochetes using a phase contrast microscope to see them. These carnivorous parasitic creatures are easily seen in the saliva, blood. Some people, like I said, have between hundreds and 1,000 of them. So, and then part 2 of this video, I'll be going over several research videos and other clinical documentation of research about spirochetes and the many diseases known and unknown that they cause directly or are part of the disease being manifested. Most of this information is too sensitive and controversial for social media. Part 2 of this video, along with hundreds of other Earther Academy video courses, workshops, recipes, personal protocols, and many departments of information, are available at Earther Academy website. $10 a month, cancel anytime. So let's start part 2, but again, let me switch over now to this is the big screen. How do we do this? Okay. That work? Oh, here we go. This one. There we go. So again, I'm going to put the macroscopic size snake, and microscopically, remember, you have to see it on a microscope. But macroscopically, this is what those things look like. Okay? And they spin like this inside the body. And there's many different classes of these spirochetes. Remember, Lyme disease is caused by spirochete. Syphilis, spirochete. A lot of things, and that's just of the past. And I'm sure there's a lot of research out there. People want to go ahead and do it. You'll see that spirochetes are involved either with the disease or a cause of the disease. Either or, they're present. So, like I said, we'll go over more clinical information on part 2. But also, remember, the biggest thing is once you find out you have them, and or most likely you do have them, and or to have a protocol so you don't get them anyways, even if you never check your microscope on microscope examination. I use certain mouthwash that I use all the time, and I show you, like I said in that video, medicinal mouthwash and toothpaste. Using 3 simple ingredients. Make it yourself. It's cheap. Don't ever buy mouthwash again and throw your toothpaste away. The toothpaste is very damaging. Forget about the fluoride and everything else. We already know that. And the people that don't understand that, guys, most likely my information's a little bit over your head is because you got a lot of other stuff you should learn first. So upgrade, enhance, and optimize yourselves, guys. Take care of yourselves. Don't, well, be strong, get strong. And the only way you can is to work hard at it. Get a strong immune system, right? Get a strong physical body. Get a strong mental mind to be able to build your information field, to get more information so you can make better critical thinking decisions based on the information field that you have seen, not just what you've heard. So it's best always to be able to do the microscopic examination so you can prove to yourself that you have these little satanic bastards living in your blood. Simple as that. And then the next question is how do I safely remove them or reduce the colonies and or bring them down to just a few weeds in my garden? Who cares? But if I'm growing arugula and it's only a foot tall and I've got weeds 3 feet tall, the weeds maybe will steal the food and everything from the plant because they're all competing for food, but it's going to block out the sun and that plant's going to wither and die. It's going to take over because the other plant is taking over the terrain, and that's not the terrain I want. I put the plants in my garden that I want. And in the body, remember, if you have a probiotic type diet and you don't take antibiotics, you're not taking medications, you're not taking any things to be able to kill the microbiome in your gut, then you should be very healthy. And constantly, I am completely always reestablishing my microbiome. Watch a lot of the videos that we've done on ferments. Vegetables, remember, their microbiome's nothing. You have to ferment the vegetables to be able to make them so they're not palatable. They taste either way. You can put anything you want on them and make it taste good, but fermented vegetables are made so they're bioavailable, and it's taken out a lot of the plant poisons, phytic acid, the phytates. And these are poisons in the plants. And if you have irritable bowel syndrome, you've got stomach problems, you've got problems, just anything, you got to change your diet. Again, I changed my diet. It's been about 4 years now, and I gained about 25 pounds of muscle. Watch my video that I did from a plant-based diet to a animal-based diet. I had to rebuild myself. End of story. I tried to be an herbivore, and I don't have the same gut as an herbivore. Okay? No matter what anybody says, my O-positive bloodline could not take my plant-based diet for more than like 11 years. I start falling apart fast. Teeth were falling apart, blood in my stools, my whole body, joints aching everywhere, felt like an old bloody man. Okay, it's because I was getting sick. I was malnourished. Here's my picture, look. Check it out. Let's see if we can get it on there. Look, I was 127 pounds. Right there. Malnourished. Yeah, super lean. Super lean. But check out my collarbones. Look at that, man. That's skin and bones. I was like 127 pounds. But my dad's 200 right there. Or on 190 or whatever he is. Okay? Remember, what's in that beer belly? It's hard to teach family. That's the hardest. We all know that. But anyways, and part of you being healthy is to be able to see these veins in your arm. I call this Highway 5 right here. Okay? Look. And when I bend it, you can't, it's hard to show here, but when I bend it, the veins, they crinkle. Okay? And to show your plumbing, okay, to have plumbing means that you have low body fat. Okay? To have even just abs. Okay? And not be a fat mother. Okay? That's muscle on the side there. Okay? I got a little bit of fat right now, but that's easy to lose. I could fast for a day and a half and lose that little bit, and that just means that I'm probably taking in a little bit too many calories from maybe dairy. I have kefir every day. I have yogurt every day. Live yogurt. These are the things that help. I have colostrum every day. These are the things that help rebuild my gut. And I stopped nuts, seeds, grains, pasta, any spices, garlic, white onions, green onions, okay? Any spices other than salt to heal my gut. It's not, forget for health. If your stomach is really good, then you have to be careful on not putting in too many lectins, which are very high level irritants, which can cause a lot of problems in the intestinal tract. Poisons, lectins. Beans, potatoes, all the stuff in the skins. Oxalates, these are like little shrouds. They look like this right here. They look like a needle. And almonds have oxalates. Spinach is loaded full of oxalates. Okay? There's cacao is loaded full of oxalates. Okay? Lots of herbs have oxalates. Lots of all they do. These are protective mechanisms. Okay, that are in a lot of plants. And if you have too many oxalates in your system, these spears start damaging and or irritating the veins and arteries in your blood supply, which can give you, of course, hardening of the arteries, as they call them. Atherosclerosis, arteriosclerosis is because you have an irritative something value in your blood. Could it be possible that these rapide type crystals are spearing and irritating the crap out of your blood, and that's why maybe you have high blood pressure too? So anyways, I had a lot of problems with my fingernails were all falling apart. I didn't have enough collagen. Man, there's no collagen in plants. Bioavailable. There's no vitamin A, D, E, K. There's no creatine. There's no K2. There's hardly any bioavailable nutrients that are in plants. And if there are, you must ferment them to get the bioavailability better. That's it. There is no vitamin A in any plant there is. There's precursors to vitamin A, like carrots has beta-carotene. That's not vitamin A. That's beta-carotene. That's why when you drink a lot of it, right, you convert some of it to vitamin A, a little bit, 5% maybe, and then the rest, you start turning orange. It's because you can't break it down. So how do you get vitamin A? 4 ounces of grass-fed liver has 53,000 units of pure vitamin A, retinol A. Already bioavailable, 100%. All your B vitamins, everything else. Remember, these are nutrient-rich organs. Watch the videos that we did on some of the recipes that we've done. You eat the heart. The heart is full of mitochondria. That helps you with your heart. Eat the kidney. It has all the constituents that the kidney that you're eating has in it. It doesn't have to make it to make the kidney or repair it. It's because it's already in it. Right? Eat collagen to repair your collagen. Eat skin to repair your skin. It's the way it works. You can get some of the transition, okay, or translation of plant molecules to turn them into what we need, but very low bioavailability. And if you have better than most, then all power to you. But most people, they don't at all. So, and if you exercise or work out, you'll find out that you lose most of your hormones. So a lot of diseases, what I'm saying, has to do with a lot of different factors. It could be with your not drinking enough water, dehydrated. Remember, Earth 3 Academy, it's got a lot of pieces on water. I drink a gallon of water a bloody day. In fact, I'm going to have another sip. Could be is because that you've accumulated lots of heavy metals over your lifetime. Aluminum, cadmium, okay, pesticides, insecticides, all of that crap. You may be deficient copper, magnesium, zinc, vitamin A, D, E, K, all of them, if you're on a plant-based diet. And if you are, in time, your body becomes weaker and weaker. You may still exist, but your quality of life will be less. And once your body's reserves wear out, and you may have good reserves when you start the vegan diet. And it's a good diet for a short term. I'm not saying it's bad, but be careful. Don't have any processed foods. Because everybody's pushing all this stuff, vegan processed. Remember, soy is full of estrogen. Flax is garbage, full of estrogen. You got to watch these things. A lot of meals that people substitute for eating meat, and meat can only be, if you're going to eat it, has to be grass-fed. Grass-finished if you can. You don't want grain-fed stuff. You don't want Wagyu stuff full of estrogen. You just don't. Those are sick animals. They're all super fat. Remember, they grain them up for 3 months at least, put mold pellets in the cattle's ears to make them so the mold transfers to estrogen. Estrogen makes things fat. So cut out the estrogen in your diet. Anyways, terrain modification is all these different departments, and taking care of your mouth is a big department. Taking care of your intestinal tract is a big department. Taking care of your skin is a big department. It's the top 5. Making sure your body, of course, has the nutrition that it needs to repair itself and heal itself if needed. Repair is not fast. It's slow. Damaging yourself can be faster, but it's usually slow too. Damaging yourself over year by not doing any detoxification protocols, by not doing any exercise, by not keeping your body maintained. Shoot, I did my fingers this morning. Look at my nails and fingers. Okay, I cleaned them all and everything else. I did my feet too. I'd show you my feet, but I can't put them up here, right? But I just did my hands and my feet, as you can see. And I'm an old man. 64-year-old hand. My knuckles aren't big. Okay, everything works perfect. I don't have any arthritis. I can hold a bar hanging on a pull-up bar for like at least a minute and a half with one hand. That's the power of your forearm, is how much testosterone that your body has. It's a good indication. It doesn't mean all the way, but it means that if you can't hold your body weight with one hand on there, or even hold with 2 hands for a minute, you got low testosterone. Anyways, all right, enough. We'll do part 2, and we'll go over the things that I didn't want to show you here. But anyways, watch part 2, but read all the descriptions of any of the videos that I do. The descriptions take me a long time to do. So, you know, if you're really into research and you want to learn, and you maybe want to go ahead and understand it a little better, then follow a lot of the links that I show you too, and do your own research too. I'm just giving you some advantage, because the internet's pretty tricky, man. It's got a lot of disinformation in there. It's got a lot of trickery in there. A lot. Wait a minute. A lot. And it confuses you. Is because this says this says this. Yeah, I know. So what do? Nothing. Confused people say, I'll take a look tomorrow. And tomorrow comes, and most likely you're not going to even take a look at it because you're procrastinating. But even if you do, you're still confused. And you'll go, shoot, I'm not doing anything. It's because this says this, and this says this. Remember, hearsay. Anecdotal information is good for you to find out what other people have done in their journey too. Some people will do things and they'll hurt themselves, and it's good for you to see that, how they did that, so you don't do it yourself. And other people will say, hey, this is the best thing since sliced bread, and since I did this, and this over time, I became healthy, wealthy, happy, and wise. And I started to love myself a little bit more because I'm putting the work in me. You can put the work in on the outside matrix all you want to, but you should still spend every day a little bit of time. Every night I stretch. I stretch on my roller every night for about 30 minutes, listen to something I want to listen to, and I stretch every part of my body with it. I got different types of S-hooks and stuff, and work my back, and I'll hang from my yoga swim to traction my low back, whatever it takes. Remember, I'm old. I got to keep this machine running. at least efficiently. And of course I'm breaking down. Everybody breaks down. I'm not 20 anymore. I'm not 30 anymore. I'm not 40 anymore. I'm not 50 anymore. I'm not 60 anymore. And all we can do is, experiment. I'm not telling you what to do. I'm just showing you what I've done. And I've done a lot of stupid stuff too. But I had to learn my lesson. And part of me learning my lesson as I did, sometimes it's nice to be able to show you the things that I learned and some of the things that I was wrong about. So we're all growing and learning, and most importantly, spiritual growth is, beyond everything we're talking about here. This is what I look at. And my level now is not only doing the best that I can in everything that I do, and I'm talking just doing the best I can, making the right decision, making a moral decision, making a correct decision based on love. I can't help everybody, I do love everybody, but I really distaste a lot of people's behavior, but I still love them. And behavior, remember, is a lot to do with the computer. There's a lot to do with a lot of, I'm watching my words, with a lot of trickery to make you feel a certain way about race, religion, about past history, about guilt that you can't let go of, and or maybe jealousy, sloth, all the 7 deadly sins. These are all the best things that you can do in your life at this time is to do the best that you can do, not only for yourself, and do yourself first before you help anybody else. Make sure you're in a decent position. And if you are, of course, then you can be empathetic to others' ways, for sure. The devil's playground is not easy to play in here, is because, like I said, there's a lot of trickery here. So that's it. Say goodbye to, you can call him Kush. That was the name of my snake that I had, my viper. His name was Kush. My son named him. But anyways, we'll see you guys and learn about the snakes. Okay, we'll see you. Part 2. Whew, time for some lunch. 3 o'clock. All right, we'll see you guys.